Hi, I'm Dr. Clinton Ashford. I am a GYN physician in Athens, Georgia. I'll be giving a little bit of a talk today on the GLP-1 drugs, how to lose weight, what is the positives and negatives, how do these drugs interface with the female side of it, female hormones, hormonal female problems. Mainly, we are targeting this particular video at healthcare providers, which would mean physicians, nurse practitioners, PAs, but we'd welcome anyone to watch this, especially if you're the scholarly type and wanted to dig a little bit deeper under the hood type of thing with respect to the GLP-1 drugs, especially as it relates to women in that 35 to 55-year-old age group, which is, of course, the focus of our medical practice in Athens, Georgia. Again, the Ashford Center, Clinton Ashford, MD, and I am a GYN surgeon, don't do the obstetrics anymore. So I wanted to start off by addressing the underlying problem of all of this, and everybody knows this. The level of obesity, people being overweight and unhappy about it, has climbed dramatically over the last several years and several decades. So you could, if you're interested, and I think it would be helpful and sort of interesting, just use GPT on as far as how this goes. Just what's a normal BMI if a 5'5" woman is what is the level a normal BMI? If she's what percentage of women have a BMI at 30 or above? If so, what percentage of them are on the GLP-1 drugs? There's a lot of interesting questions you can ask with the new AI tools. You can pretty well get some very, very interesting information. Suffice it to say, and I think this is foundational as far as history goes, this used to not be a problem, or at least not the problem to which it is today. Okay, so if you turn the clock back to the 1950s or 60s, or even 70s, or possibly even early 80s, you would find that there wasn't the degree of problems with people having weight control issues. And you go back even further, it wasn't a problem at all. To prove it to you, I mean, you could do, again, searches on the internet, but if you were interested in just doing Google images, family photographs from the 1920s, you'd get obviously tens of thousands of different photograph. You won't find many obese people. It just occasional, yes, maybe. That's true in our family. I've collected photographs for decades and have enjoyed being sort of an amateur photographer, etc. Thousands and thousands of photographs from family members prior to, say, 1960. There's no obesity. Okay, so there's not a change in the gene pool of Americans by and large, but there's this enormous change in obesity. So the question is, what is the underlying problem? As everybody who's watching this knows, or at least the 99%, the problem is in the food we eat, the food industry, not trying to judge anybody or condemn food company executives, but they're out there competing in the marketplace. They want to sell their products, so they've got tasty, basically addictive, high fructose processed food. They put emulsifiers in it and a variety of other products in it that create a desire to eat more of their product. And there you have it. I mean, it's not much more complicated than that. All of this works negatively as far as patients or the citizenry in general. For example, carrying around an extra 40 pounds or 100 pounds or 140 pounds, it is not healthy. Women in this age group, for example, just since we're zeroing in that, this 35 to 55, they have much higher rates of cancer, colon cancer, breast cancer, other types of GYN cancer. They have much higher rates of diabetes, obviously, I mean, exponentially more, and vascular disease, everything you could name that they don't want, the much higher rate, 10 times the rate of ultimately needing knee replacements, having broken bones, on and on and on. Huge, huge problem. The question is, how do you address it? Well, if the underlying problem is food, not necessarily exercise, because, it's important to get exercise. I love exercise. I want to emphasize exercise, but the bigger problem at the 90% level is just the type of food people are eating. If you want to get people to eat less, change their diet, and lose the weight, the GLP-1 drugs have been fantastic. They work, and I know a lot of professionals watching this, but obviously the way they are working is making people feel full. And the medical word is satiety. There's a certain satiety factor. So even if somebody says, yeah, my favorite food for my birthday is such and such, and you give them as much as they want, they're just not going to want it. And so that allows them to sort of mind their P's and Q's, decrease food intake, and they'll lose weight. Okay, there are a few problems with this. First of all, if someone is doing that, what's the alternate nutrition? Are they getting adequate protein? Are they retraining their brain to now get away from the processed food, get away from the high fructose diet, and get on a balanced diet of fruits, vegetables, healthy foods, and all the things that everybody's mother has already told them that's what they need to be eating, so no big secret on that. But a lot of times they're just not hungry. They're not hungry for the junk food. They're not hungry for the other stuff either. They need to, food is medicine. They need to work to retrain their brain on liking certain types of food. Furthermore, if they just go on without changing the diet, they just go on the GLP-1 and they're losing 20 pounds, 30 pounds, 50 pounds, 100 pounds, 150 pounds. The problem is, number one, what's the nutrition going? Getting back to what I just said, and they'll wind up having certain predictable side effects. And the predictable side effects would be so-called Ozempic face, which is loss of musculature and subcutaneous fat and other fat in the face, which, people say, well, I don't want a fat face anyway, but truthfully, they're not happy with this. They want to look normal, they want to look the same, they don't want sunken cheeks, etc. So the Ozempic face, hair loss, significant problem with the GLP-1 drugs. There is problems with osteoporosis, otherwise so-called sarcopenia. Sarcopenia is loss of muscle mass, so, just muscles, legs, arms, core, all of it. You don't want to lose muscle mass. What you want to lose is the unnecessary fat, right? So adequate nutrition, in fact, high protein diet of the right types of food. Okay, this gets to the next part of it, and very, very important. If you will address the GYN issues that I'm going to mention to you, and there are two categories of GYN issues, if you will address those, one, people will lose weight faster. Two, they will likely be able to keep it off, and all of this has been documented, and I can send you all the documentation for this. Three, they will be able to avoid a lot of these unnecessary side effects, and they will feel better. And truthfully, they're going to live longer. They're going to have less osteoporosis by a long shot, less cardiovascular disease, and truthfully, by maybe factor of half the amount of dementia, Alzheimer's disease later on in life, if they will just stay on the GLP-1, get back to a normal BMI, and they will do what I say on the GYN side if they're 35 to 55. So sort of a new part of this talk, the two GYN issues we're talking about are, one, problems that are related to the inside of the uterus. So the uterus is about the size of a lemon, large lemon, small orange. It has an internal space that is lined by some hormonally active skin, endometrium. And that's the part that bleeds. So it builds up and sheds and builds up and sheds and goes through the cycle we all know about. So if a woman is having heavy, irregular, painful, inconvenient periods, then it's pretty obvious that she has a higher rate of anemia or at least low ferritin. It's very, very likely she's going to have fatigue. Well, I mean, you don't need a medical degree to know this. If someone has fatigue and all they want to do is just sit and they go to work and they come home and all they can do is just say, stare at the TV. No judgment here. It's just if they feel really, really crummy, it's not serving them well. If you can get rid of the bleeding with endometrial ablation and just stop the bleeding, the anemia will self-correct within a month. We know this is true. You never hear about anemic men, or at least rarely, and yes, there are genetic problems, yes, some other things that men can have, but 99% of anemia and fatigue related to anemia is in women, and frequently women in this age group. If you stop the bleeding, they're not going to have the problem. They're going to have a lot more energy. Secondly, and a lot of people do not know this, they attribute this to something else, but it is the endometrium, the lining of the uterus, that not only bleeds, but leading up to the period for that several days, maybe a week, maybe even 10 days, leading up to the period and during the first part of the period, the endometrium is degrading and it's releasing a vasoactive neuropeptide. That is what triggers all of the famous premenstrual complaints. Because I do this every day and I'm asking the questions, I can tell you about 80% of women will have significant premenstrual complaints. The most common ones, the famous ones, the fluid retention, bloating, the headache, the mood. The mood falls into 6 words: anxiety, irritable, anger, depressed, emotional, agitated. They'll have just fatigue over and above the bleeding, over and above anything else, just per se. They'll have food cravings, typically the chocolate, salt, sugar. I have countless women that say, I do not even like chocolate. And so here, leading up to my period, I have my secret chocolate stash up in my cupboard so the kids won't find it, and I'm compulsively eating chocolate or salty stuff such as potato chips or the sweets. And then there are other variants of that, meat, different things. But the food cravings, so all of these are working at cross purposes with losing the weight, right? I mean, this is, again, common sense. If you want to keep a normal appetite, in a sense, at least to a point, at least so that you are really focused on retraining your brain to enjoy healthy food, meat, vegetables, fruit, natural food, natural fiber, and just to the degree you can do it, almost zero high fructose corn syrup, minimal sugar, and minimal starch. I mean, everybody knows this, and certainly all the healthcare providers watching know this. But you want to really, really double down on healthy type of food, the protein, whey protein powder, whatever it is, and then the fruits and vegetables. So if someone feels better, it's going to be a lot easier to retrain their brain, retrain their behaviors. I mean, just because they're on the GLP-1 drug, but they're going to work and coming home, what they're not doing is going home and feeling like, golly, I'm tired, but if I eat 2,000 calories of starchy, high fructose food, I'll feel better. Well, they're not going to do that, but they're still not going to feel great, and they're going to go home and sit on the couch. They're not getting exercise. They're not running by the grocery store and saying, I've got some great recipes. I want to try some different things and new things. Cook it up, feed it to me, my family, and they're not going to be doing it. There's a certain period of retraining. So I look at the GLP-1 drugs a little bit. I mean, I like them. I think there's a huge advantage. You're going to wind up using the GLP-1 drugs like training wheels on a child's bike. Use it make some progress with it. People need to be followed closely, and they need to be encouraged to be on proper nutrition. They're going to have a lot higher success rate if you get rid of the things that I talk about, all of which relate to the endometrium, which means the bleeding, the anemia, the fatigue associated with the bleeding, and the premenstrual complaints, the fluid retention, bloating, the headache, the mood, the food cravings, the fatigue, and the like. Getting back to the mood, there is the comfort food thing. You know, if someone's anxious and depressed, the GLP-1s are not helping this one way or the other. They're just making it so you're not compulsively eating the comfort food. So again, long term, it would be so good just not to have the mood stuff anyway, have a happier life for sure. You know, so many women that I see, and again, I see it, this is the perspective I ask people about. Yeah, you know, when my husband and I have an argument, it's during that premenstrual phase. I hear this constantly, or you name it. And so they're just not happy mood-wise. And if you could get them back to feeling like my mood is like the week after my period, 365 days a year, they're going to do a lot better. So the other half of the female situation in the 35 to 50 year old group is what I'm going to tell you now. About age 40, women do start having some very gradual decline in the output from their ovaries. That decline continues until they're 60, 65, 70, with the point being it is a long period of time from here to not very much. Some will drop suddenly and trail off, others later. Either case or any case, at some point, women do drop through a threshold, and most will have some complaints of declining output. The most common two things, the hot flash, night sweat thing, of course, everybody knows this. They can also have mood, depressed, can't think, can't remember, can't come up with words, names, numbers, brain fog, cloudy thinking, can't sleep, wake up and then can't go back to sleep, hair, skin, the vaginal dryness thing, fatigue, weight gain, sexual, libido, honestly, 25 complaints, and no one has all 25 things, but one thing or two things, most common hot flash, night sweat, but really all of it. So if a hypothetical woman says, yeah, I'm in this age group, but a few months ago, 6 months ago, I was at work, unpleasant hot sensation, quickly subsided, woke up at night, sweaty, what is this? Pretty good bet she's dropped through the threshold. Therefore, it's a pretty good bet if you restored what was missing, the hot flash would go away. And if she says, yeah, with that, but they were right about the same time, my mood and depressed, and I can't think, and cognitive, and brain fog, and sleep, and hair, and skin, and vaginal sexual fatigue, weight gain, all of it. It's a pretty good bet if you restore, it'll all go away. All revert to normal. Not always, in the sense that men have insomnia. I mean, you can't blame everything on this. A lot of it you can. So part of the answer to all of this is, if someone's having symptoms, do hormone replacement therapy. Again, as I said a little earlier in this talk, it has been proven, is demonstrated, women are going to do better, they're going to lose the weight faster with the GLP-1 drugs, and they are much, much more likely to keep the weight off and even be able to get off the GLP-1 drugs permanently if you will address the GYN issues. So the GYN issues, again, the things related to the endometrium, and then things related to the ovaries. So furthermore, the nutrition, they're not going to get the Ozempic face, because the estrogen replacement therapy is going to maintain the muscle mass and the subcutaneous fat in the face. They're not going to have the hair loss, by and large. It's a combination of both the hormone support and better nutrition. They're not going to have the sarcopenia. They're not going to have the osteopenia, osteoporosis. So in every single category, they will do better. They're not going to have the food cravings. They're going to be able to retrain their brain. So again, these things is a little bit common sense. So if if you are using the GLP-1 drugs and you feel comfortable with, say, look, I have people, I give HRT all the time. I feel very comfortable with that. This is wonderful. If you have any questions, you could let us know. If you would like some tutorials on this, if you'd like to, just reach out to our office. This is what we do. One of the things I might warn you about is if someone says, yeah, like I'm having the hot flash and night sweat and my brain fog and I'm having trouble coming up with words and some other of these complaints that I just mentioned, mood, sleep, etc., etc. If you simply say, look, you sound like you're deficient in ovarian output, and she says, yeah, I think so, and you just give her a supplement, there are two things that are going to happen, possibly. One, you're going to start stimulating the endometrium. I mean, that's what you're doing, clearly. Furthermore, if you give the estrogen, and it's required if someone has uterus in place, if they have a hysterectomy, have had a hysterectomy, you don't need to worry about that. If they have a uterus, you have to give, it's standard of care, some progesterone. Well, the progesterone is going to degrade the endometrium. So you're stimulating it and you're degrading it. So what will happen, and I see this, I would say every day, they're going to restart their periods, or the periods are going to become irregular. And this is exactly what she does not want. Another way of putting it is the one thing she's happy about is the periods are slacked up. The other thing, and most women don't notice this or verbalize it unless you ask them, but if you kind of go through what is unique to them about the premenstrual complaints, whether they're more the headache person, the mood person, exactly what categories, the anxiety or more the depression or the anger or whatever it is, what's going to happen is now, instead of that premenstrual stuff, mood and other complaints occurring right around the time of the period, and then after the period, I won't feel like that. You're going to have a chronic low-grade version of that 365 days a year. That's how it works. So what you're doing, yes, she's feeling better because you supplemented her in the cognitive and the brain fog and the sleep and the vaginal dryness and the hair and the skin and a lot of other things are better, but then you're stimulating and degrading the endometrium, and now you're having the bleeding and the chronic low-grade premenstrual complaints. So again, why deal with any of this? And so if that's an issue, the simple answer to that is get rid of the endometrium. If you don't have an endometrium, you're not going to have any bleeding. Nice, one less thing. If you don't have an endometrium, there's nothing to degrade and release the vasoactive neuropeptide, so women will not have this ongoing premenstrual complaints, probably genetically determined, because different women will say different things, but it's probably just genetic. And it's interesting to say that because it's true that different women will have different things, but it's not that she is doing something wrong and she's doing something right. I think it's just the way people are made. So anyway, so these are the points I would say about the GLP-1 drugs. Yes, we're in favor of it. Yes, but still, don't forget, we're trying to retrain the brain. We don't want them to necessarily stay on the GLP-1 drugs forever. We want them to lose the 40 pounds, the 50 pounds, maybe the 150 pounds. Yes, they'll live longer, they'll feel better, less osteoporosis, less sarcopenia, less Alzheimer's disease, dementia. We want, but it would be great if they didn't have to stay on this stuff forever. If you use it like training wheels on a bicycle, and then after they kind of have things recentered, they're back to their normal BMI or where they want to be, then they can just go on from there, riding the bicycle to extend the analogy, without training wheels for the rest of their life, have a wonderful, happy life without the symptoms that I had mentioned before, all the symptoms related to the bleeding and the premenstrual, and all the symptoms related to declining output from the ovaries. So again, I am Dr. Clinton Ashford. This is what we do all day, every day, really focusing on this 35 to 55 age group. If I can help you I would love to do it. If you are a healthcare provider, please call our office. It's Dr. Ashford, drashford.com. Get in touch with us. We would love to help you or advise you or answer any questions or provide you with documentation if that's what you would like. There is zero charge. We do not charge healthcare providers for any information, and we'll help you in any way we can. If you are not a healthcare provider and you are interested in HRT or the GLP-1 drugs, and you say, I've thought about it, all of this is making sense, you can give our office a call. We would love to help you as well. Get you back to feeling normal, 100% normal every day, all the time, 365 days a year. So go to our website. Again, that's drashford.com, and we're in Athens, Georgia. We do televisits, so can make it really simple. So give us a call if we can help you. We'd love it. Thanks very much.